8, which is our smoke-free item. So welcome, Kat, Michael, Deborah, team. Thank you. And just while the group settle in, I do just want to acknowledge members. Thank you for the excellent questions and putting the time into really listening to the presentations that we had from our multiple presenters. It was appreciated. Thank you. Kat.
Kia ora koutou ngā mihi kia koutou. We'll just quickly introduce the action plan, I suppose, from the staff point of view in terms of how it's been written up. So from the staff point of view, this plan is about sticking to our knitting. It is based on two core things that is a foundation of Council's work, which is connections to community and community empowerment and places. So it's bringing together those two things, people in place. It does focus on trying to both manage, as you know, the evidence around some of these matters and the controversy over some of those evidence with what we actually heard from the high smoking prevalence groups that we're actually trying to influence. So it has tried to balance those two things out. It is highly focused on high smoking prevalence. It focuses on cohorts, where they live, who they associate with, and what they have told us might influence their journey to stop smoking. It is based on our smoke-free policy and some of the data we've provided to you previously around not achieving those dates, mostly because of the high prevalence smokers. We've also focused on where harm is occurring. So smoking tobacco-related harm is occurring in high smoking prevalence populations, which for Auckland is, high percentage is Māori and Pacifica. I suppose I'd just bring your attention, if you've looked at the plan, you can see we totally reiterate our role and how our role can work with the role of others. We've identified the roles of government, health professionals. We've identified that the actions from this action plan are about helping the targeted groups access stop smoking services. This plan is not about council moving into cessation, and from our point of view, it is also not about promoting vaping. This whole plan is highly targeted to people, if you look at the statistics, which we'll go through in a minute, who are not giving up smoking. Therefore, the tools that are available to date, you'll see in the paper, there is evidence that they're kind of not working for that population. If you have a look at the smoking stop rates, I suppose vaping is a bit risky. It's seen as a potential breakthrough product, though, for Māori and Pacific smokers. And as you know, wahine Māori are very high prevalent smokers. I think, as the Ministry of Health has said, if we could get wahine Māori to give up smoking, we'd probably meet the smoke-free target. So we have unashamedly talk to people who deliver services to those smokers and listen to what they've told us. We are trying to look at something different. This plan was asked for by this committee. It is not a separate part of the smoke-free policy or a separate part of the smoke-free implementation plan. It is in there, and it of course works with all those other actions that actually are occurring. So it is not a standalone thing. It is something which works together, but we're giving ourselves a chance of influencing our group who are high prevalent smokers, and these are the people that you'll often see smoking in the public places all around the region. So I just suppose we just wanted to just be clear that this is not a generic support for vaping action plan. The whole conversation, the audience for this action plan are people who smoke and who seem to be unable to get on the stop smoking journey. We have got some evidence that we can present to you. The evidence, there are lots of different views. The evidence is young. We've presented you this before. We've said that evidence will be emerging and we will have to keep a watching brief. We have thought in this plan that perhaps the risk on the evidence was worth it for harm reduction just for these target groups only. And that's why we've kind of put it in here. So I'll just get Debbie to just walk you through just some of the key bits of evidence that are being used at the moment that are about New Zealand.
Thank you, Kat. Can we move to the next slide? Oh, this one? Great, thank you. The problem. Sorry, are you able to do it from there or?
Oops, that's worked.
Oh, it's working now? Okay, great, thank you. Thank you. So this is just a little snapshot of some of the evidence, and really just, I think, to very, very much reassure you that we have paid a lot of attention to the evidence. And some of the data that's presented here responds to some of the questions and issues that have been raised today. So this is Ministry of Health national data that looks at how we're tracking towards smoke-free 2025. You'll see that the smoking rates for Māori and Pacific are much higher. 2017-18, 31% for Māori, which is nearly a third of the population, and 20% for Pacific. And the medium-term targets that are required in order to reach the smoke-free 2025 target, 19.2% for Māori and 11.5% for Pacific. And we are a long way away from those. Okay, This just illustrates the progress that is or isn't being made towards the 2025 target. You'll see that by 2025, smoking rate for Māori in Auckland, if the decline continues at the same rate, will be 12%, but they won't reach the 5% target until 2030. And for Pacific people, it will be 10% smoking prevalence by 2025, and they won't reach the 5% target until 2031. So both Māori and Pacific populations are a long way behind the rest of the population. There was some discussion this morning around the Ministry of Health's perspective on this. Here is a very recent press release from Jenny Salesa, who's the Associate Minister for Health, who has responsibility for this area. And I'll just run through some of these things. She presented this information at the forum on vaping that was held in Parliament last week, where she focused on the 2018 survey results, where 29,000 Year 10 students are surveyed about their smoking behaviours and attitudes. So just some key points from that survey. The data shows that just 1.9% of Year 10 students smoked on a daily basis, and more than 81% of those surveyed hadn't smoked at all. So that's great news. By comparison, 6% of Māori girls smoked daily, and while that rate had decreased, it's still higher than the overall rate of 1.9%, so a bit more than three times higher. In relation to vaping, according to the ASH survey, Year 10 vaping in New Zealand remains low and largely among students who smoke. It's the 2018 rate was 1.8%. There is still no evidence to suggest vaping is a gateway to cigarette smoking, and that is based on a review of the evidence in New Zealand. And finally, only 0.5% of students who have never smoked vape daily, and that had dropped from 0.8% in 2017. So the proportion of students that are using vaping that haven't smoked is very, very low in New Zealand. This graph was, or this data was presented by Associate Professor Natalie Walker, And without going through all the detail, it really highlights the differences between Māori Pacific and then non-Māori non-Pacific. And you can see that the blue-green columns are experimenting with electronic cigarettes and cigarettes. Yellow is the regular use of electronic cigarettes, and the purple or blue is the daily use of electronic cigarettes and cigarettes. And you can see the rates are much higher for Māori and Pacific than for others. So I'll just move on to that. One of the people who presented at the symposium last week was Professor Hayden McRobbie. He would be widely regarded as one of the leading tobacco control authorities globally. He's done a lot of work in the UK and continues to do work in New Zealand. So these are some of the slides that he presented last week. And also Hayden's been involved as an investigator in the largest trial to date of vaping as a quit tool. So it may be a little hard to read, but the graph... thank you. Oh, thank you. The graph on the left looks at the harm that's associated with different forms of smoking. So the left-hand one, which is the green column, is no harm at all, and that's from no use of anything. Much less harm. You can see that the graph going up, but the blue column includes the fourth one in from the left is e-cigarettes, and that's the estimate of harm associated with e-cigarettes. And the burgundy-coloured column on the right is the estimate of harm that comes with cigarettes. So those are ratios, and you can see that there's a very big difference between the estimates of e-cigarettes compared to cigarettes. That's been summarised in the diagram to the right. The blue line shows increasing health risk as you move up the blue line. You can see the yellow line indicates the decreasing risk of health issues as someone is quitting smoking, and that down to a point where someone is vaping. And then, of course, if you've never smoked, then you would be right at the bottom. So what that illustrates is that there is some harm associated with vaping, but it's a lot less than what the level of harm that's associated with smoking. On a similar vein, I guess we're really focusing on, the overall objective of this is to reduce the death and disease that is caused by smoking. This is some analysis based that looks at an estimate of the cancer risk. And again, this is a ratio. You can see if tobacco smoke, the risk is at 1, then the ratio for vaping is 0.004. So again, significantly less harm associated, or cancer risk in particular, associated with vaping compared to tobacco smoke. And just to summarise Professor McRobbie's perspective, and I think it's fair to say that these are the kinds of things that we would probably all agree on. People coming from cessation services or researchers, and so just to run through those. The conclusions are, or that Professor McRobbie reached are, there are likely to be some adverse health effects associated with long-term vaping, so concern is warranted. However, this concern needs to be balanced with the concerns for the health and well-being of people who continue to smoke. For smokers, switching to vaping and stopping smoking completely is likely to be associated with a reduction in health risks. And he added that this is supported by the current literature, and to mitigate concern over unknown health risks associated with long-term vaping, ex-smokers can be advised to stop smoking as soon as they feel able to. So I think those are probably the views that most people would agree on, whatever their perspective on this is. And just finally, this is some very recent research and analysis that's been released in New Zealand, where there was some modelling work done on the health and cost impacts of liberalising the vaping market in New Zealand. The researchers estimated that the net health gain, and this is for the 2011 population, over the rest of their lifetimes. So the net health gain they estimated at 236,000 quality adjusted life years, which is significant, and that the net savings to the health system would be $3.4 billion. And their comment on that was that this would be a similar impact to the tobacco tax regime, and it's widely agreed that the tobacco...
Does that mean what you save on is what you
goes on tap for the cigarettes.
Yes. Yes, net savings, yes. Yes, so that suggests that the impact of this would be similar to the effect of the tobacco tax regime, which has been the most effective tobacco control mechanism in New Zealand. So what they recommended was a fairly permissive regulatory environment with targeted smoking cessation advice in addition to that, but also to make sure that marketing and age limits were implemented to prevent uptake in young people. So that's just a summary of some of the key evidence that's informed the plan.
Are you ready for questions on that? Okay.
Thank you. That's really good information. I just wondered, years ago we thought smoking was fine and doctors would prescribe it for anxious women who had, nerves and things like that. Have we had enough time to have a good longitudinal study around whether there will be long-term effects on the respiratory system? Because we've certainly had that with cigarettes, and that's what it's very easy, because I worry about saying, it looks all right now, but you can't compare the evidence base yet to that of tobacco because this has only been around a short while. And this moment in time looks good, but what happens to my 22-year-old if she keeps vaping? Will she have as bad a lungs as she would have over time with tobacco? That's a kind of thing. I want to know that we're not basing it on that feels cool today, but we don't know. And I know we can't know.
Through the chair, that is a totally legitimate question, and I think the evidence would say yes, there is a need to have concern. It is not without health risk, and I think that diagram explains
Just can't read it
totally. Sorry. I just think
I can't read what it
no
says.
one is promoted. I just think if you look at the red arrow going up, that is someone who has never smoked. If they vape, they are having more harm than if they had not vaped at all. That is not the topic of this audience or this conversation.
Right.
The topic of this conversation is the yellow arrow coming down from people who are smokers. This is not just ordinary smokers. This is the smokers who haven't yet given up from a whole regime of tax increases, new medications, cessation services. So I suppose we're trying to talk about what we believe is the people in the yellow. We are not trying to talk, promote, or say anything to the people who would be in the red.
Okay.
But that is the concern, and it is a concern that in the future there may be evidence. I suppose of lesser concern is that smoking is by far worse at this point.
Okay, and can I just ask another one? Sorry, because I can't read everything on there.
Yeah.
So is this vaping with nicotine in it or without nicotine in it, or because is there a different? I mean, one's addictive and one isn't. I don't know, but is there?
I'm vaping with nicotine in it because that's the mechanism that smokers use to reduce their smoking or to quit smoking.
Right, so it's all got in it, but there's the other ones that have just funny flavours in them, or have they all got nicotine?
You can get vaping products without nicotine, and some people in their quit journey progress from vaping with levels of nicotine that they gradually reduce over time.
Okay, thanks.
Sorry, I'm hoping this question relates to it, but I've got to do everything I can in my community for smoke-free and vape-free, because the cost economically, socially and culturally to our people is way too high. And it seemed like you present some numbers there that's a zero-sum game, because what we receive ends up being in the hospitals and what we pay to mitigate smoking. But anyway, it shows here, I'm glad we had this because the vaping seems less harmful with the research to back it up from this professor. But I'm going to put vaping aside because it all looks like it's smoke. However, whether they're lighting it up or using a machine to blow it out, I think the semantics are a bit kind of very thin. But what I'm concerned about is, or if I'd like to get some clarification, is how does the funding that we provide filter down to the agencies on the ground to deliver services to their communities, such as the Māori and Pacifica agencies that we're here today, because it seems like they are on the ground doing the work and seeing the results. So could you explain how that filters down or how the funding's managed?
So at the moment, you'll see in the plan we've talked about grants. The reason we've talked about grants is because that is the mechanism council generally has to take its funding and give it to community providers when we're not doing contracts for services. The how is something we will be talking with those organisations. But so there is an implementation part of this. They have concerns about certain ways of doing things, as you've heard today, so do we. But I suppose I could say that Hapai Te Hauora and the Pacifica groups have helped develop this plan. So they talk to the communities who believe they could assist them with their jobs. Some of them, the examples we've been given is, for example, some community groups sell tobacco to fund community facilities and community services. So working with those community groups, we've heard from Tongan men about the kava, I don't call them kava parties, that they have to promote not drinking alcohol, but they've talked to us about how much smoking goes on at those, and connecting with some of those church groups with the cessation providers to work through some of those places we can't get to.
Just another quick
Those
question.
are just examples of
how much is going to the grants? Is it 900,000
So
that's going to the grants, or is it 1 million, 1.1?
At the moment, the money in the report is 1.1 to implement this action plan.
Okay, thank you.
So just to be clear, because I think Member Blair's question was a really good one, and this is what this strategy pivots on. We can either spread the money thinly across the whole region, across everyone, or we can focus where the issue is, and the issue is Māori and Pacific communities who are telling us that if we're going to focus, that's where the grant money should go, and I think Member Blair's point is important.
So just to be clear, we're not promoting an either-or situation. We are promoting that this be part of the implementation, and that there be approximately 1.1 million of that 2 million focused on this, and about 0.9 million that will still be used for those regional promotions and other activities within the implementation plan.
Councillor Watson.
Just a question on the survey that formed the basis of the first few slides, that they and this is for young people and year 10 students. I just, and you might not know, but I just wonder why they chose like that year level, because basically depending on what time in year 10 it takes, that's actually students that are quite young. So, you know, if they're not smoking at intermediate school or on third form, then, you know, the assumption is that they've been smoking for a while before the survey starts. So was there any data as to why they went in so early in the students and not maybe year 12 or which might be a true indication of the percentage rather than those quite low percentages, which I imagine will just capture the sort of hardcore people that have started quite early on in their lives?
Through the chair, thank you. It's a good question. I don't know why they specifically chose that age. This survey has been running for a number of years, and so they've been able to track the changes over time. There's also a measure taken at age 17 to 18, and so there seems to be a bit of a jump at that point. So there are some questions about what happened. in that period. So I think that's a very, very valid question, but I'm not really sure why they chose that in the first place.
Well, I think you've answered it. It jumps up then when it gets up to the older age groups. Thank you.
So we're on just questions on the report.
I've got a couple. The first is, although this is targeting those quite specific geographical areas, I think what I heard today is that we have a job to do with all of this public spaces that we own or manage, and I wondered how that's going to be written into this. And we heard today about, for example, bus shelters and stadia. What in addition to this, I think it's absolutely critical that, you know, people in Mangere don't stay in Mangere. They come up to the city centre, they take the bus, they go to the station, they go to events that are beyond Mangere. So what are we going to do in tangent about that?
Thank you, and through the chair. So this is one of the actions that was identified within the smoke-free implementation plan. So this is the bringing into fruition the action that we agreed to, which was to develop a Maori action plan and a Pacific action plan. That was part of the implementation plan. This does not replace that implementation plan. All of the other activities that were identified through that implementation plan will be ongoing.
Yeah, well. It's the will be ongoing that I'm asking about. Specifically, we've heard today that it's not actually happening, and we heard one example, for example, of Auckland Transport not putting signs up in bus shelters. So,
yep.
What does it mean when we say it's in train or it's
so there are certainly areas where we could have done better, and some of those examples that were raised this morning were specific instances where the implementation may have not been fully completed or completed as well as it could have been. So one of the examples that was given was around bus stops and bus stations. Or Auckland Transport has not, to my knowledge, had any concerns around funding and has implemented smoke-free stickers and signage into bus stations and bus stops. The degree to which they have rolled that out into all of the individual bus stops is where there is potentially more work to be done. Similarly, there was the issue raised in relation to the inclusion of smoke-free provisions within leases. That was later clarified that it is being included in leases for new leases and new leases when they come up for renewal. There may be the odd case where that has been overlooked, and I will take that back and we will follow up to make sure that all of those lease renewals are having that requirement included in them. We've also continued to roll out the smoke-free requirements through our alfresco dining licences. That's been going very well, and we've had positive feedback from the community on the changes that has had. And we're continuing to work with our bids and our local business communities to look at ways that we can support them to encourage their town centres and shopping areas to become smoke-free as well. So there is certainly a lot of work that is ongoing. There is also the issue that's been raised around the smoke-free coordinator, which we are still in the process of actually recruiting. And as soon as we get that, there will be that dedicated resource to work across the whole of the council family to ensure that the momentum around this is maintained and increased in the whole range of implementation that's included in the implementation plan.
So in the first instance, Mike, can we make sure that in those 9 targeted areas that we do we do a really good job with everything else that we've promised to do, so that we use them as a, if they haven't got the money to do everything, let's do them first, kind of thing. Yes. And my second question is back to vaping, because I've been kind of going from one side to the other, and I'm in the middle now. I think that the one that had most affected me was Stuart Jones, and that was, rather than just saying vaping as a switch, why not vaping plus any other, effective method? I think I'd like to see that, rather than, it doesn't preclude vaping then, but it just acknowledges that there's more than one way to skin a cat, so to speak. So that means a wee change to what we've actually got in the action plan, but I'm open to see what other councillors think. I now have an issue with just that.
I hear what you're saying, Councillor Casey. Should we work through it and then we'll see what that small change might look like? Okay. So we're still on questions. I've got Councillor Walker, Bartley, Darby, Fletcher, Goff, Simpson, Newman, Cooper.
Mine's to speak.
Yours is to speak. Okay, I'll put you on the speaking bit. Sorry, we're actually also, to add to the fun, we're just completely resetting the computer here. So, Councillor Walker.
Okay, so I've got a few questions, and excuse my ignorance, but essentially, right now, my understanding is that you can't smoke in public places and so on, and we're able to enforce that, but you can vape. Is that correct?
So right now we promote smoke-free public places. There is no legal enforcement of that. So it's not a bylaw. So we won't use the enforcement word. So we promote denormalisation through promoting smoke-free public places. And our smoke-free policy does not include vaping.
Okay, so you can vape in public places. And vaping, or whatever it is, does it contain nicotine?
Some vape products contain nicotine.
Okay, and from a perception point of view, and I don't pretend to be an expert, but in terms of smoke, which I characterise as something I see in the atmosphere, when somebody's vaping, they generate a hell of a lot more smoke than the person that's smoking.
It's not smoke.
But yet it's not smoking, so-called, yet it does contain nicotine. So frankly, I guess my next question is, in terms of the amount of budget that we're going to be spending, how does that budget rate against the budget that the companies involved with vaping are spending? Do we have some analysis on that?
I guess, Councillor, I'll just give the staff a moment to think. Just getting us back to the issue in hand, when we went through our policy around smoke-free, we categorised smoking as the burning of tobacco, which is pretty blunt, and then there's vaping, and we got to our decision on vaping with a degree of debate, but that's where we got to. What I'd really like us to focus on here is our action plan based on our most vulnerable communities and the way that we're going to deal with it. So I don't know whether we've got access to the huge budgets that tobacco companies have, but I think if we could just bring your point a little bit more clearly to the issue in hand.
My concern is directly around what we're doing, which goes directly to the amount of budget that we're spending, which has a direct correlation, a negative one, with the companies that are spending vast quantities of money to encourage people to vape. And as far as I can see, it involves alcohol and it involves smoke, and there are real issues from a marketing perspective around perception. So I've got personally a very real problem with how we are tackling this issue, and I'm most uncomfortable because, frankly, I think we're going to be up against marketing machines that are far more astute and have got access to much bigger budgets than what we've got. So I just want to...
And just to answer through the chair, the money is to implement the action plan, not to implement and promote vaping products for people who profit from vaping. That is not the action in the action plan, in the work streams, in the action plan. It's myth busting and people sharing quit stories with other people in their communities. So I think the action plan does not state some of the things that are starting to be perceived.
Thank you, Madam Chair, through you. Thank you for the report. The previous presenters all talked about a Māori and Pasifika action plan, but nowhere in our report is it labelled a Māori and Pasifika action plan. Why is that?
Through the chair, we had a direction from a small smoking working party that was not appropriate. And so that is why it does not appear on this action plan. So, sorry, that was a working party of councillors.
Okay, all right. Okay, and my other question, like what reassurance do we have? Because this implementation plan, the council's one, started in 2017 and people have said we're not even following this. So what reassurance do we have that we are actually going to do what we say we're going to do in this plan? And how, like, who's monitoring it so that people don't turn up here and tell us you're not doing what you said you're doing?
So through the chair, I think there are sometimes misperceptions between doing nothing and things not happening at the pace everyone else thinks they will. The council and the region is large. We have thousands of parks, bus stops. We have thousands of leases and license agreements. It does take time, even with resourcing, to get those flowing through everything. So I think, you know, there is that issue of how long does it take to print 1,100 signs? That it's taken us over a year working with sign companies to get those done. It's not that nothing's happening, it's just that it doesn't all happen at once. And we will always, as a council, have examples where people can point out where something hasn't been done, and then we can follow those up. But we're not getting perfection, we're getting action and step-by-step progress. So it is being implemented.
Can I ask one more question, please, Madam Chair? So I do have the concerns about vaping, and I really hope that that we're satisfied that there isn't going to be that collateral effect of us ending up looking like we're promoting vaping. So I'm really keen to hear your thoughts on how we make sure we don't do that. But the way that you guys have said in point 42 that the risk can be mitigated is by communicating key messages focused on the evidence. What is the evidence though? Because everyone has said that this is an area where we need more research. So what is that evidence?
I think when we're talking about evidence, we're talking about evidence to smokers. So this plan isn't about general communications to general people. The community grants aren't just for general communications, they are communications and messages specific to smokers and smoking groups. So some smokers do think vaping has no impact on you. That is incorrect. It does have an impact, just like many of the prescription products to give up smoking do, Champix, Xanax, they all come with very long and detailed medical warnings about the harm they can create. I do think we need to be really clear to smokers about that harm, just like they are with stop smoking medicines. There is harm, they need to be clear about that. It is not harm-free. So I think everyone assumes that we're going to put out messaging that this is harm-free. It's kind of the converse. It's less harm. It's a harm reduction product. It is not a device that you are trying to stay on forever. There needs to be messaging around a step in stop smoking, stories about how other people have gone from nicotine to no vaping at all. These are the kind of stories we're talking about, where people get examples of how they've just used it as a tool. You can go on Quitline and it'll give you information about vaping, but not enough to truly understand some of the ins and outs of it. That's, I suppose, what we're talking about, really clear messaging.
Okay, we'll keep working our way through the questions and then move to speaking. Councillor Darby, you're next.
Sure. Kia ora, and thanks for your work here. Hey, just in terms of some of these stats here, it's a bit hard to read that and read other stats and try and work all this out. But this is the New Zealand story as told by the minister there. How far behind is New Zealand from, say, the US in the availability of, that is the commercial availability of vaping? My understanding is vaping is pretty recent here. US is at least 5 or 6 years ahead of us.
Thank you, through the chair. We're probably a little bit behind the US, but generally, you know, these products have been available in New Zealand for a number of years now. So, yeah, I'm not sure that how much of an effect that would have. Except that I think it's worth noting that one of the signalled intentions with the changes to the Smoke Free Environments Act is to strengthen the regulation around vaping products.
So just to clarify, I thought there was a district court decision which went in favour of Philip Morris against the ministry, and it was out of that decision that the whole retail vaping just took off. Look, I won't. In the US, though, the numbers there are totally contradictory to these numbers. So there, in 2015, the Surgeon General indicated a 900% growth in vaping, and 40% of those had never ever smoked. So is there a risk of growing a brand new cohort of vaporizers with health implications to solve the smoking problem? Is there a risk in your eyes?
There is a risk, except I think you have to remember the price of cigarettes in the different areas is quite different. So it's a big step up as a gateway from something relatively cheap to something that's, I think it's $30-something for a pack of 20 now. So some of those, it's quite difficult. You're actually having to expend quite a lot more money. That could be one explanation, but I don't know, it is hard to say because this is about New Zealand evidence, and that's what we've got at the moment.
I could add to that. There's also a different way of looking at this as being not so much that we are behind, but that we are ahead, because we've got an opportunity to respond with regulations at the national level early on before we get to the point that America has got to before they actually got a chance to respond. So in that regard, the situation that we're in is actually a situation of privilege, because we get to actually learn from the mistakes made by other countries overseas, such as America, in terms of the way that we nationally regulate the sale and supply of vaping.
Thanks for that. And I also noticed in the UK they're reporting that half of e-smokers, e-cigarette users, are former smokers, which means the other half are brand new to vaping. So look, Madam Chair, I'm just trying to navigate this because I have some concerns about maybe being explicit about vaping in that section 3 that Councillor Casey was referring to. And I'm probably just wanting to signal here that I would be more comfortable if that referred to smoking cessation programs or something like that, rather than explicitly vaping. My other question, and last one, is I think the Cancer Society were recommending that we home in on, and I hope I didn't ask them any questions because others wanted to have a fair share of the questions. They were wanting us to home in on activity stream 1 and 2 and to be mindful of other agencies that could actually satisfy attending to the switch to quit. Do you have any comment on that? Hopefully I got them right. Was that how you read it, Chair? That this Cancer Society were homing in, asking us to home in with our modest budget on streams 1 and 2 and allow others to take care of switch to quit?
I think the difficulty we've got, Councillor, I can see what your question's aiming at, but if you listen to Hapai Te Haura talking about by the people for the people and do it in a way that works for us, it may well be switch to quit. So, you know, we somewhere there is a, you know, I think we can overthink this a little bit, and I'm listening, and we're in danger of doing that a little bit. I think we need to get all the questions out on the table, but you know, it's quite clear that there is a differentiation between what the Cancer Society and Public Health think and what some of our frontline organisations think, and we can work on what the middle ground looks like.
The community-led projects, I agree, that they're, according to the paper, they're handled in work stream 1 or activity stream 1. So just a quick comment then. Do you think that the best bang for our council dollar is in activity stream 3, where possibly other agencies could actually be addressing that or should be addressing that.
Sorry, through the chair. I think if you have a look at the types of activities that are proposed in the switch to quit, they are a few activities around narratives, myth-busting, some communications. So you can kind of tell by that we do think the bulk of the 1.1 is going to 1 and 2. You can have a look at the different types of activities in your brain. You can quickly calculate they are bigger, probably more costly, more resource intensive. So the activities are lesser in that area. We weren't going to play a really, really big key role, but I suppose we were also not going to come down as a naysayer and a stopper and someone who was regulating and banning in that area. We were trying to contribute somewhat, not to the extent that I think people have read into the plan, so that is an issue. It seems to be read in as the major activity.
Thank you. I've got a very specific question, and it probably follows on from Councillor Bartley, but it's about vaping and switch to quit and those sorts of messages. The community that I am most interested in and that in my mind are the most vulnerable are potentially pregnant mothers. If there is a time in your life when you are most likely going to quit, it's when you become pregnant, if you are a smoker. And I'm worried and I'm concerned that this campaign is for a group of vulnerable young women. A message is being sent that this is somehow okay. And I want to know what work you've done specifically on targeting those women and the age groups of those women in and around the campaign that might be pregnant. Because for me, there is only one message when you're pregnant, and that is nothing. You know, it's not switch to quit or anything like that. And we've heard today that there are inherent risks, and surely the most vulnerable should be these unborn children in any consideration of this policy. So I'd like to know what work you've done on that.
And the short answer is we have not specifically targeted young pregnant women at this point.
So I guess, Councillor Fletcher, we need to get this program off the ground before the targeting can happen. That's my understanding. Okay, Mayor Goff.
Thank you very much for the work that's gone into that. I had another question after I heard Councillor Darby speak. If those figures that he has suggested are accurate, that 50% of people in the United States taking up vaping who didn't smoke and 40% in the UK, they seem totally at odds with this. So I'm just wondering whether you're aware of those figures and whether they can be authenticated. That's my first question.
Yes, we are aware of those figures and we're happy to share any research on that.
Well, I think that what we're doing in this action plan has the unintended consequence of looking like we are enthusiastic about vaping and giving it unqualified support. I say unintended because when I heard your explanation up there, I know that's not what you're intending, but it's how the paper reads, and that's why we've got the reaction. The second question is, if I look at activity stream 3, it says create more supportive environments and a harm reduction approach for smokers who want to quit by switching to vaping. And I endorse the sentiment that several people have mentioned that it shouldn't just single out vaping, it should be smoking cessation programs. But my question is really, since you use the word vaping there, how do you intend to create more supportive environments for vaping, and what are you proposing we should do? Because that really is a test of precisely how we're approaching vaping. If it's about simply promoting cessation programs for people already smoking heavily. Absolutely agree with that. It's better than smoking. But I worry about the breadth of that quote and what it might mean. And I also worry about the fact that actually if we're encouraging people to vape in smoke-free areas, that's not a good look and not the right message.
So through the chair, I suppose the short answer is we are not supporting actively going, please vape here. However, we are conscious that people, this is what we've had through the providers and people who've used vaping to give up smoking, are often attacked in public places as if they were smoking. And so this does not help them sometimes on their journey to be completely smoke-free. So there is that part around education that it isn't smoking, and perhaps you shouldn't approach people who are vaping like sometimes people do with smokers, in terms of the conversations they have about that. So people can be quite sensitive about smoking or vaping in public places, and they can be quite aggressive in their approach to that. This was trying to say, actually, it's not the same thing. Don't approach the people the same way. We have had feedback from some of the cessation providers about that in public places. But mostly it was about helping with information, working with smoking cessation people and health providers around what the true risks are, how it can be helpful in terms of what the evidence says, in full support with things like Quitline, other smoking cessation services. So it was never us. We're not doing smoking cessation and smoking cessation promotion. It's working with others to do that. I think you can see some of those in the action plan on page 25 and page 27.
Thank you for that. I still don't have a clear picture in my mind how you create a more supportive environment and harm reduction approach by for smokers who want to move to vaping without looking like you're promoting vaping. That's the contradiction in the objective. I absolutely accept that vaping is better than smoking and it should be part of the cessation program, but I'm really not sure how you're going to do that by what you set out here, and I think that sends the message that causes some alarm with, good people like Stuart Jones who does know what he's talking about. So I think we really have to think that one through a little more than we have.
Okay, so let's hopefully by the time we've reached the end of the questions, I'm going to ask the team to maybe suggest if we were of a mind to modify without losing the total intent of that objective number 3, what that might look like. Councillor Simpson, you're...
Chair, look, I'm struggling a bit with this because I want to start with the evidence, and the evidence that, my first question, the evidence that you have used initially is 2013 census evidence, right? Correct? And we've got the minister's evidence up here by way of her press release, which must have, because it's national, correct? Is that correct? National evidence. It must have an Auckland component, and I would have just liked to have seen what her Auckland component was vis-a-vis what we had to start with. That's my first question, my sort of first point. Have we looked at that?
Through the chair, as has been referenced, there was a conference down in Wellington on Thursday and Friday of last week, which Deb attended. So that was when this information was presented. Right. We haven't had the opportunity yet to delve into the detail of the division of that data out to the regional levels yet.
Okay, my second question is, although we've identified where we think the communities are with the highest number of smokers, where they live, do we know where they work?
Through the chair, no, we do not, Councillor.
Right. So my point is, if we're targeting where they live and we don't know where they work, potentially how they get there and where they end up is just as valuable as where they live. So that's my next problem. And then I'm going on to the vaping issue. My question around vaping is, have you considered the offer that the University of Auckland made for research, actually looking at some research around, because what I'm struggling, I don't know, I don't even know how much it costs to buy a packet of cigarettes, let alone what it costs to vape. But it's that second-hand smoking, you know. We know that what's in a vapor, if I've listened to the experts correctly, we know that what's in the vapor, with whatever you inhale from the vaping, has got nicotine in it. But there's no robust evidence, according to item 27, that vaping represents second-hand health risks, yet people think it does. If they're sitting next to someone who's vaping, they don't like the fact that smoke is blowing in front of them. So I think we really need to clear that up, and surely there must be something evidentially around the world or somewhere. Is there absolutely nothing around there?
So at this point, so if we're talking about outdoor settings,
Yeah.
there is no evidence of second-hand conditions from vaping, as there is no evidence in most outdoor situations for smoking. So they're very similar evidence bases, and that evidence was presented to the regulatory committee. Right. So I think,
I suppose I struggle with that. If someone's sitting next to me smoking a cigarette and there's no evidence to suggest I could inhale, I mean that's been a whole targeted campaign of kids in cars and everything, isn't it? And
so that's indoors, so that's in a confined environment.
Right.
Yeah.
Look, and so yeah, I'm sorry. I'm just challenging. I just don't know. And as for core council business on this, honestly and truly, I'm struggling. Whether how sort of what we should be doing as opposed to enabling others to do more, really, in the scheme of things. So the vaping thing, I haven't got the evidence to help me with an informed decision. So I'm struggling a bit with especially stream 3. 1 and 2, fine, but stream 3.
Thank you, Madam Chair. I acknowledge the depth and the breadth of the debate. It's hugely valuable, and everybody's concerns are justified. But I want to just maybe touch on the report insofar as a couple of questions I've got around if I was to read it as read. You've mentioned the implementation plan in response to Renata's earlier question about the budget. So the report is tailored for a particular community, notwithstanding its regional sort of bandwidth, because it names a number of suburbs, but in task 2 it leaves a number of suburbs out that they name, i.e. it's just focusing on Tahuhu, Manurewa. But in your report, you've got GI, Point England, you've got a whole heap of other places. So earlier, the questions were asked around the regionalisation, or is it the specific grouping? And I saw the answer as both, insofar as the report, that regionally, so if you expanded 2 to include the report areas that you've reported on, rather than just 2 of them, I think there's 8. For me, that begins a genuine attempt about the region insofar as a targeted audience, because any alternative is just perpetuating the status quo. And I'll say that. Mm-hmm. Any alternative is perpetuating the current status of what we have. So any councillor here worried about branding or profile or reputation, I'll buy that when you upgrade standards on stormwater when heavy rain falls and it can just wash all our sins away. This is no different. So the end justifies the means, because we had people in here who I also credit with evidence. They gave us their community evidence. It may not have been academic, it may not have been medical, and it may not have been scientific, but it was fact. And the fact is that these tools and instruments are needed by some of our community. And the fact is, if we choose to do something else, then all we've done is isolate them and ostracise them. So on the contrary to anybody thinking we're cutting people out, all you're really doing is perpetuating the status quo. So going to my question. In response to the 1.1 that you've got in front of us, I want to know why the whole 2 million hasn't been allocated to this dedicated community. I want a conversation about that, and do you have an answer?
The reason it hasn't is because we do have other commitments in a wider plan that will support the actions that are specific to this plan. So I think we've had some conversation about these things seeming to be two separate things, but they're not really. One is a very broad message about smoke-free awahikore, and then this is a very targeted package that sits within that, and they are working together to try to promote smoke-free. That would be my answer to that. They're not competing, they're not mutually exclusive.
I accept that, but we had also within the healthy debate this morning and presentations a pretty deliberate thrust over things like, one coordinator. Now, with respect to all of the communities, I know this language, it's inherent in us. Somebody else can actually prepare to tell us what's best for us. That was followed up by communities that were saying they were connected with those communities. And they were saying, without saying, I want to be the coordinator, that they were here to help us. So I want to know, because I see the KPI of it a lot easier to measure if you regionalise it up against your report suburbs. And I understand what Councillor Simpson mentioned around, well, where do they work? Because that's relevant, right? So, but I'll buy the report and the substance that you've put in front of us around. My view is regionalising it with those communities that you've left out of too, but you put in the substance of your report. They should be included in that second item. And my view is that once you do that, there's no change from $2 million for that community. And around your implementation plan, I would have thought would be a lot easier to measure and audit a dedicated community rather than a regional thrust of what I'm saying is perpetuating the status quo.
Member Brown is around the funding. In essence, is the funding sufficient to do that focused work? Is that the question? Yeah. I mean, I guess to save our staff the embarrassment of saying the funding is never enough, but we've only given 2 million into this, and the reality is this is probably the best split that could be found. I think the points you raise, we probably need to enter into the debate on that, because I think you've actually harnessed exactly what the discussion point is for our debate. Councillor Newman.
Yeah, thank you. A very complex issue, I can see. Para 34, in areas where targeted smoke-free activities are proposed, local boards will be offered an opportunity to contribute to designing local activity. I apologise if I was out of the room when this matter was addressed, but can you just confirm, what does this mean? And if local boards are offered the opportunity to contribute, are local boards funding that, or they're contributing, you're funding? Talk me through what that paragraph means.
Thank you, through the chair. Just as an example of this, one of the initial activities that we looked to do was around the Manurewa Town Centre. So we were looking at ways that we could increase the profile of being smoke-free in the Manurewa Town Centre. We had a lot of support from the Town Centre manager around that. We then brought the local board chair into that discussion as well, so that the local board and the Town Centre manager were in conversations together with us around what would be the most effective way to do that. There was no sort of financial obligations on the local board as a result of that, but it was bringing the local board into the conversation with the other parties and partners that we were actually working with. So that's what's intended by that comment. When we're actually working this out in their communities, we will be working with them as part of that community to do that.
Thank you. I know the Town Centre manager and the chair well. They're very good people. turning to attachment A, page 27, we're dealing with the communication and promotion. I think you might have answered it to an earlier question from Josephine Bartley, but so the regional budget, this is going to pay for all the signage costs and needs that are going to arise that local boards might have in their community. This pays for all of that, and is that part of the communication and promotion? I just want to, because one thing I don't want is for local boards to come back. So we've got this regional strategy. A lot of it's going to be about advertising, promotion, and signage, and actually there's not enough funding for that, and people are coming to us. That's not going to happen, is it?
Just before we go to the answer, can I just get some of the councillors to turn your microphones off? It's just a little bit hard to hear.
We would expect that that wouldn't happen. So I suppose the key thing we can say is we have printed a large number of signs. We have used the money that councillors voted us in for those signs and to install them. So at this point, we're hoping we've got enough for all our needs. Local boards won't have to cover that. And then there is this $2 million. So within that $2 million funding package, there is no need for local boards to support outside of that unless they wish to.
And my final question, I have real issues with this, but my final question for that signage, how many languages are we printing in?
At the moment, it is just Oa he kore and smoke free.
Councillor Hills, Member Blair, Councillor Bartley, and then I'm looking at everyone. We're flagging. We need to actually work out our way forward. So.
Thank you, Madam Chair. I guess we are getting distracted on vaping. This is about tobacco, about smoking, about dealing with that. I think also we're kidding ourselves if talking about vaping or including it in our strategy is encouraging it. We had free public transport on the Friday before Christmas. We weren't, and it was mostly around drink driving. That wasn't because we were encouraging alcohol and drinking. We were talking about safer ways of stuff that's already happening in our community, and we're not going to stop it. So just, I think we're going a little OTT over even discussing it as part of our policy of stuff that's happening. Regardless, we don't have the ability to ban any of this stuff as a council. My concerns I just want to ask is how do we make sure, because I think the groups who have presented today, yes, they were consulted, but maybe only in the last few weeks, how can we get them ingrained in this work to come, to make sure that we're putting all this up now, but how do we make sure that everyone's kind of on board and happy with the direction and with especially with targeted stuff in different communities, how can we make sure we're taking their advice? I'm sure we are. And then the other thing is, can you just again reiterate exactly what this strategy does for vaping? Because everyone's getting distracted on it and I'm now buying into that. But can you just put it out there again exactly what that is? It sounds like we are putting signs up going, hey, everyone come vape. But that's not what this policy is saying at all.
Through the chair, so we are trying to support those who want to quit smoking through vaping. And some of the actions around that are to equip them with information about vaping and to generally, as a council, not be totally anti-vaping in our messages.
And to your first question around how we're going to bring others on board with this, we are continuing to work with all of those stakeholders that you saw present today and others as well. The vast majority of those are very enthusiastic about working with us, and we will be utilising that coordinator, activator role to actually continue to build and strengthen those relationships with those external providers from across the whole sector.
I guess the last point is, because there's varying views from the stakeholders, like and community and with councillors, how will you continue to balance all those views along the way, especially when you're working with local boards and communities who'll be making separate decisions apart from this committee?
I suppose we all balance all our competing views between what we think should be done by focusing on the outcomes we are all trying to achieve. So achieving outcomes doesn't always mean we all have to agree on the methods, but it means that we have to agree to work together on the outcomes, and that's the approach we continue to take. This is a difficult topic. It is on an area of smokers who basically everyone is finding complex in terms of getting stop smoking to stick. We have worked with some parts of those stakeholders who work directly with those smoking groups, and we've presented you something with, as you can tell, a level of risk and boldness, and that brings debate. So there is this, the vaping is just totally debated area at the moment.
Through the Chair, if I could also just add to that in terms of the Stream 1, By Us, For Us. Our commitment to By Us, For Us is around how can we bring the parties together to support the community to deliver what they want and need to actually increase the levels of quit smoking in their communities.
Thank you, Madam Chair. Just like to urge to keep in option 3. We walk the marae, the sports fields, the reserves, the kapahaka comps, the Māori and PI events, homes, whale. We've heard from them today. We also walk those areas, and they're prepared to put their reputations on the line to see option 3 in there. I understand there's marketing, there's legislation on the way that's going to prevent the marketing of vaping as well, so there's measures on the way for that. Also think that I've seen evidence on the slides that you've presented about vaping and heard from the doctor. I'd really like to see the majority of the funding targeted towards Māori and Pacific Islands for them to do the work for their people. They need to urge. So do you have any tags within the funding to ensure that the money, I asked it before, is focused towards the Māori and Pacific Islanders communities? Or is it a free-for-all?
So the $1.1 million identified in the report is purely targeted at funding Māori and Pacific stop smoking initiatives. Yeah.
Thank you, Madam Chair. My question is it a fair assessment that Ka Pai Te Hauora said that normal ways don't work for our communities? So if there was to be an amendment that would change this to switch to smoking cessation programs, that would actually incorporate the normal ways, which they have already identified don't work for our communities.
Through the chair, it's kind of not that cut and dried. So they're saying added to the other ways they promote, vaping is showing a bit of a breakthrough for them on some groups that have been difficult to move using the other methods. But they still use a variety of those other methods and support. So that includes like one-on-one, person-to-person support, the quit line support. So none of this is like, here, go vape. They do a lot of the other cessation support around it. So it's not so much one or the other, but I suppose they're saying, but this is a legitimate tool. And I suppose they are fighting a little bit for the legitimacy of this tool amongst the others as something that has a high potential to work for hard to move groups.
Right, I'll ask people to hold on to that because that is the essence of the entire debate. Very quick question, Councillor Walker, and then we'll go to the debate.
Do we get any money from the government for our anti-smoking promotion exercises?
Through the chair, this is the money this council through the LTP voted to sit alongside that national budget and those national initiatives that are delivered locally. So it works in complement, but no,
so
there's no specific.
They don't give us any money. That's all I want to know. No, okay, no. And the other question I've got is just around the signs that are part of this campaign. So what do the signs say?
Most of the signs are simply the smoke-free logo. This is a smoke-free area. Please do not smoke here. That sort of message. It's making the public aware that this is an area where you're not supposed to smoke.
So we're not spending any money on promoting vaping in terms of signage?
No.
Just want to be real clear on that. Okay, thank you. That was quick, Madam Chair.
Okay, we've got, I think, moving into where to next. Now, the two issues that I've heard really clearly is, as is and as recommended, that picks up the points that have been raised by our community smoking cessation groups, and it leaves it at to change. Sorry, I've forgotten what the little thing is. The change to quit, the switch to quit, by allowing a slightly more supportive approach to vaping, or to water that down and switch to use smoking cessation methods of a wide variety to quit, which doesn't necessarily pick up exactly what the community smoking cessation groups have asked for. So our decision is whether we want to go through as is or whether we want to see that amended. And the question was, I think, asking our staff if people were of a mind to water this down. I mean, I'm happy to put this on the table to vote on. I'm happy to move the recommendations as they stand and to endorse the smoke-free, this part of the smoke-free action plan as it is. So that's A and B. And if there's a seconder for that, I mean, we could second it by Councillor Filipaina. So we do have the opportunity just to debate that and vote on that. If people aren't happy, then we can choose a different outcome. And or if people have an amendment. So we've got the recommendation on the table for debate. Councillor Cooper.
Thank you, Madam Chair. I had a few things to say. I've worked as a practice nurse in a medical centre in the deepest, darkest of McLaren Park, which is one of our high Māori and Pacifica populations. It's some time ago now, but I've also represented that area as well for a long time. And so I know it well as a health professional. And one of the things that Councillor Fletcher said about women stopping smoking, believe me, in those communities, they don't when they're pregnant. They don't. You can tell them all the horror stories, you can encourage, and it's really, really sad. If I'd had a vaping to say to someone, here, have this instead, I would have done it. I would have been so happy to have something that stopped that baby being suffocated for 10 minutes every time the mother had a cigarette. So for me, you know, in those communities, if there's a tool that can help, that would be amazing. So it's different for us, you know, maybe women who are in a different situation where it's just a different world. You cannot even compare. So it's easy for us to think about doing that. Not that I smoked when I never smoked. The other thing for me is that what's really clear to me right on this page 14 is if you want to do activity stream 1, you have to allow activity stream 3, because that's what we've heard from our communities. By the people, for the people. They know what works. If you take away number 3, you take away one of their tools. And that's what concerns me. We're being hypocritical. And we're sitting up here going, we know, well, we don't. I'm not going to swear. So the thing here is, I worry too. I worry about what's in that vaping stuff. I've got someone in my family doing that. But I also wish my eldest daughter would do that instead of smoking. And it pains me as a former registered nurse to have my mother and two of my daughters smoking. It kills me. But I know that. That's why it kills me, Councillor Simpson. And that's why if they're going to vape, at least they're not smoking. So that's that part of it. The other part of it is if you actually read the activity stream, it's switch to quit. It's not let's encourage vaping as an alternative to smoking if you've never done it before. It's not that. It's actually talking about, we heard when we did all of our working group that was really important. So we've created a stream that supports what the community have told us. So that's why that's important. I think if you wanted to so-called water it down, you could say something like, support initiatives for smokers who want to quit by switching to vaping. And then it doesn't sound like we're putting up signs and saying smoke here if you vape. You know, maybe that would take that kind of risk out of it, because we're already granting money for projects to do these sorts of, smoking cessation, which includes the vaping thing. So we're already doing that. So you could change it slightly. It would still allow those groups to do what they need to do, but it wouldn't give the message that we're encouraging vaping everywhere, if that's an issue. Just something to think about. When you buy a $30 packet of cigarettes, you smoke the whole thing because it's costing you a lot and you've got to do it within the time before it burns down, right? People who smoke will know that. If you've got a vape thing, what I've noticed when I see people, they carry it, but they'll go puff and then won't do anything for quite a while and then they'll another puff. And you can see it on the motorway when you're there for ages and you'll see this big puff come out the car, but it's very intermittent. It's not like a cigarette that just goes on. And so I'm just thinking of the practical aspects of this, that even if people do get to vape in a Awekore area, it's not as prevalent and kind of all-consuming and disgusting as a smell, and not so often. It doesn't sit there for 10 minutes. So I'm not too worried about people smoking in those smoking. But I mean, if we want to do the whole message, keep them out of there. But I really think you can't get rid of 3 if you want 1. So I don't know if that all makes sense, but right at the beginning of this, I was thinking, oh, take that out, let's do that. But I hear the community where it really matters, and where it really matters is those areas where that is a really good tool and the practitioners see that it has and they've done the research. So for me, leave it in, but if you want to just say support initiatives for smokers who want to quit, that might, Madam Chair, just clarify it more, that it's not saying we'll just allow you to do it everywhere. Thank you.
Do you wish to, you ready to?
Thank you, Madam Chair. Wasn't expecting that call. I'm broadly in favour of the paper, but I think because it's approving the action plan as it is articulated creates a sense that we are enthusiastic about vaping as a tool and we are giving uncritical support to it. And I haven't quite figured out how you might do this, but I think that there are 3 things that we need to note in it. One, that vaping is a legitimate tool to help established smokers quit, because it is. Nobody disagrees with that. Secondly, noting the need to avoid encouraging non-smokers from taking up vaping, because we need to be explicit about that, particularly in light of the figures that Chris Darby mentioned. And the third part of it is express caution about the way I've got it, so there's a better wording, but caution about overselling the safety of vaping when the negative impact of vaping is still not fully known. That kind of just balances out. You know, we're doing the 95% less harm. That might be correct, but I did listen to the figures that have come out more recently about, you know, the impact. It's the stuff that came from Stuart Jones, actually, the impact on drop in lung functions of 5% over 2 years. That seemed to be scientifically based, and that is a concern. And their view also that you know, that e-cigarettes have toxic substances from aldehyde and other aldehydes that do damage. Your slides up there, Kat, actually said that at the bottom in the red, but the overall impression of the presentation, or in this paper, is that we've just bought vaping hook, line and sinker, and we're not sufficiently aware that there may be a downside there. So I'm not quite sure how you want to handle that, Madam Chair. I haven't thought it out myself yet, but I just think we just need to note those 3 points: legitimate tool, careful not to promote it to non-smokers, and the jury is still out on the overall impact of vaping on health. Those points need to be made somewhere in the paper, so we are taking a balanced approach. Thank you.
I think, Mr Mayor, they can be definitely picked up in, I was just having a look at where, so on page 27, it talks about what we're doing with the switch to quit, and on more further through the paper as well, we can just modify and bring those points in, and that we may be able to just soften that.
May not need a formal amendment, but if we can have an undertaking that those points would be built into the paper, I think a whole lot of us would be a bit more relaxed.
Maybe recommendation B, to delegate the staff through the Chief Executive to make minor amendments and changes. We can pick those up as the debate happens. The point's really, really clear that we in no way want vaping to be seen as endorsed, or that it is uncritically viewed, that the dangers of vaping are clearly stated in here. However, compared to the dangers directly of cigarette smoke and burning tobacco, it's a slightly lesser evil. Councillor.
Thank you, Madam Chair. And just, yeah, once again, thank you for pushing forward with this. I know that this is the tough end, right? So we've done everything for years. As a country, you know, I remember the days when it was controversial. Well, I was 17 or 16 or something, but it was controversial that we were banning smoking in bars and clubs and workplaces, and it was nanny state and everything else. And I don't think anyone could possibly believe that you could be sitting in a cafe now next to a smoking table and a non-smoking table. I think in the youth space, we're looking at, you know, the figures are pretty amazing. I've lost them now, so that's great. In 2001, the Youth 2000 studies, which are the largest studies with young people that you could, you know, the sample size is massive. 2001, young person who has at school who had tried smoking was 53%, 2007, 32%, 2012, 23%. We can assume the next study, which I think has happened last year, will be even better. For those who smoke long term, it was in 2001 it was 16%, 2007 it was 8%, and then 2012 it was 5%. So there are fewer people taking up smoking, and it is because of the government's changes, the regulation, the price, the stuff that councils are doing, the smoke-free. We are doing stuff, so all our new signs in our parks have smoke-free logos on them, so the new being replaced, leisure centres have them on them. We saw in the media we're getting lots of pushback from hospitality because they've just realised that signing up to new agreements, they're not allowed, their trading licences, they're not allowed to have smoking on the footpaths. Yes, there was a spike of that over summer of the complaints, but I think majority of people, as the stats show, are happy to be sitting outside and not have smoking around them, and that will be creating behaviour change, and that I think is one of the easiest ways for us to do it. We need to work harder on some of our sports clubs and the old school kind of, oh, yep, we can still stand outside and have a ciggy. So we need to put a lot more pressure on that around what we expect, especially on our land. I think this plan, putting the vaping aside, I think we cannot ignore vaping, and it's clear, that it's much, much better. That there's no tar, carbon monoxide, everything. There are issues with it, and I won't deny that. But I think the other issues around with people, for people, it's not for me as a young Pākehā male to be talking about what's best for Pacifica and Māori communities when they are the most affected by smoking and addiction in this case, and clearly the messages and other things aren't working in a way that we just blanket do some of these things. So I think it's important. I trust that you guys have heard our concerns, the many. I trust that you're going to make sure this goes through the process. We don't have to decide everything by committee and resolution down to the minute details, and I trust you'll continue to work with our teams. But environment change is as important. It can't just be these fun little activities that go out. I think we need to be pretty prescriptive around the grants and the events or whatever the programs are, because otherwise it's just wasted funding if we're not really targeting and specific and long term. I think just flash in the pan kind of couple of nice posters aren't going to do much change. But I think this is really good. I think it is part of what a council should be doing. Yes, the government does the big stuff, but the well-being of our communities is just as important as the government's priority on that. So thank you for this, and I think it's a very good start. And there's a lot of information in here, and I'm sorry we got fixated on vaping, because it's actually about tobacco, cigarettes, and smoking. We've come a long way, but there's a long way to go. So thank you.
Thank you, Councillor Hills. Councillor Darby.
Thank you. Look, I'm mindful of standing orders from recent meetings. So the Mayor has spoken and he's proposed some amendments.
Just to be clear, what I asked for is feedback for well, these are not amendments, they're actually editorial changes in the body of the report. So we're just noting editorial changes for the body of the report, which we can do easily, because B is delegate staff through the Chief Executive the ability to make minor amendments to complete the action plan. So what the Mayor's suggesting, and we're actually just taking a note of here, is to just throttle back a little bit on it all being about vaping, to make it clear the concerns about the safety of vaping as a concern, and it's over there. And there's a third thing. So this will be changes in the body of the report, so it's not an amendment.
In the plan.
In the plan.
Yeah. And that's what I was referring to, because it's not an amendment to the motions. So clarification, there was a question, Councillor Casey, myself, others, about modifying activity stream 3 to take out the reference to vaping and substitute words something like and raise awareness of smoking cessation initiatives or smoking cessation tools, which would cover anything, in place of the emphasis on vaping, which doesn't exclude vaping, but it actually brings back the very successful tools that are mandated by the ministry as well. So the question I thought was going to be posed to the staff, and they were going to come back to us on that, what would be the appropriate wording of that section if it was more general? I'm trying to avoid putting up an amendment.
Can you just put a full stop? No, because it's entirely appropriate for us to be looking at I'm far more interested in changing the body of the report if needed than dicking around with a whole lot of amendments. So you could put a full stop after quit and just have, by switching to vaping, just because then, as Councillor Cooper so rightly put it, by activity stream 1 and 2, if we're genuine about those, vaping will come to the surface, because that's what our community smoking cessation groups have said will actually work for Māori and Pacific communities. So we are dancing on a pinhead here, but we are starting to make it quite clear that we don't want this to be interpreted as a huge ringing endorsement for vaping, and nothing could be further from the truth. So if we just put a full stop after quit and take vaping out, that might just calm the horses. But I'll just, while we gather our thoughts, the Mayor's suggestions for the body of the report are some of the changes is that we need to put in here, vaping is a legitimate tool to help established smokers quit. The need to avoid encouraging non-smokers from taking up vaping needs to be made clear in here, and awareness that potential negative impacts of vaping through some word or another, through
Well, vaping is less damaging than smoking. The negative side effects of vaping are still not fully known.
Thank you.
It just creates a context,
Yep.
I think.
So we need, that's the message that we want to get in here. But I think, Councillor Darby, if it helps for activity stream 3, switch to quit is just the full stop after quit.
Okay.
Would that help?
Can I ask, but I want to ask the staff that because they're the experts in this. That's why. So I hear what your proposal is, and my proposal was that partner with others to disseminate switch to quit messages in priority communities. That's important, and raise awareness of smoking cessation initiatives. That was the difference. So that's in the plan, not the report. So I think what the Mayor was proposing is amendments to the plan, not the report.
No, we're only changing the plan. No one's changing the report.
She just said report by mistake.
Okay, just to clarify.
Through the chair. You're both saying the same thing. So what we could do in stream 3 is you'll see the longer version. It says switch to quit, and then it goes create a more supportive environment for smokers who want to stop smoking. You put the full stop there. We'll get rid of specific references by switching to vaping, and we'll have to go through the document a little bit, but we will make sure we mention you can switch to quit through a whole range of other methods. We will make sure that broadens out to include those methods and not just refer to vaping with that.
I've got it. It's clear. Thank you.
Yeah.
And Councillor, we're saying exactly the same thing. That's awesome. Phew, we might be reaching agreement. I've got Councillor Bartley, Member Brown and Councillor Watson.
Thank you, Madam Chair, and through you. I thought how you ran this whole item was pretty awesome because we really got a fulsome debate and chance to ask questions and hear all sides of it. So I heard the precautionary approach from Dr. Stewart and from the Cancer Society and really appreciate the positions they took. And I think that what is proposed in changing the body of the plan will accommodate those concerns, because from what I hear very strongly from Hapai Te Hauora is that the normal ways do not work, and also from Pacific Health and Welfare, and they support this plan. Both groups, Māori and Pasifika, support the plan wholeheartedly, and we are always going on about how we need to hear from our diverse communities. We want to do more engagement with our diverse communities. Well, here we have Māori and Pasifika groups saying that they support this plan and that this will work given the realities of what they're facing on the ground. So I'm more than comfortable to go ahead with this plan, and I thank the officers for the work that they have done, and also for including GI and Point England, who always get overlooked because they're not South Auckland, but they have the same issues. So thank you for that.
Thank you, Madam Chair. So, going to like activity stream and 2 of the report, I earlier asked a question about why was it that the other suburbs weren't included in the context of the report. So that maybe a question I've got is, it is in the plan. That doesn't need amendment. Or is it not? So on the activity stream, the second one.
Or if I can just, councillors, I'm going to suggest, I can see everyone's getting a bit tired. I'm going to suggest that when we've put the recommendations, we actually take a 5-minute break just in case people are getting a bit, because I know I am. I really need a 5-minute break and I need coffee. So I'll take a deep breath. So Member Brown, my need for coffee got in the way of my hearing the last little bit of detail. So it is a why the other
Suburbs.
Suburbs weren't included, thank you.
Yeah, did we miss one? I'll go and ask.
Including Facebook.
Having a break? We can follow up on which suburbs. Yeah, I don't know which
Okay.
counties not.
Okay.
Okay, so Member Brown, you're comfortable?
Yeah, that's okay.
But there, okay, Councillor Watson.
Thanks, yeah. I've just got a few general comments to make. This is an important topic given the cost to the health system of smoking-related illnesses, not just for the poor souls that land up in there, but to the rest of us too, in terms of the resources smoking-related illnesses take up. I mean, I just had an operation on my arm a little while ago, and in terms of my recovery, the surgeon only asked 3 questions. You know, one was, you know, do you have diabetes? I said no. He said the other one was, do you smoke? I said no, and he says, the other one, are you a complete arse that'll do something stupid with your shoulder? So I said, well, I wasn't so sure on that one. I knew the answer to it. So even in a pretty straightforward matter like, you know, a basic operation, your chances of recovery if you're a smoker is less than anyone else, and quite dramatically so. To be honest, it's a little disappointing after all these years of these, you know, very expensive and continuous advertising programs that have just gone on ad nauseum for decades. I know there's been an improvement, but to still see the statistics that there are today is really not all that encouraging. Notwithstanding the progress that has been made, it reminds me of my own family back in Scotland. Not so long ago, I went to see them, and 90% of them smoked, and they smoked like chimneys. So you go along to a party, it'd be freezing cold, be no windows open, central heating would be on, there'd be about 30 or 40 people crammed into the living room, and 50 or 60% of them were smoking. So at the end of the night, you were just about ready to keel over. And after a week of it, you're just about yellow. And their response was, I mean, they had the same ones and same programs in Scotland, and they just said, oh, it's a lot of rubbish. It's a lot of rubbish. It's exaggerated, all this stuff about smoking. It doesn't do you, and that's what they honestly believe. Virtually all of them had died by the time they were in their mid-70s, if not beforehand, of cancer, funny enough. And I just wonder if there's not an element of that it's in our own communities too, where people, just no matter what and how they get educated, that the resistance to change, that their lives are on another sphere altogether. And it probably does to recognise that rather than thinking that reason and education and alternatives will prevail, because clearly for numbers of people it doesn't. They've got other things going on. I would just like to say on the vaping thing, and I'm glad the people that are the experts, you've got to listen to them. I guess they're on the ground. They know what works, both from the health perspective and also for the people that can see change where it can be made. So I'm certainly willing to do that. But just my parting shot for the whole vaping thing is, I mean, I didn't know that it's not harmful. I know that it annoys me if anyone blows big smokes of stuff in your face. In most cultures, that's insulting, and you get you a smack in the face in some places. So, in amongst all the discussion today, I'm not quite sure where we landed with vaping. Yeah, sure, encourage the people to go into vaping if it helps them transition. I agree with that, but I don't think you should be encouraging people to vape where smoking is prohibited, and I think you've got a hard job if you're going to try and educate the whole of New Zealand then that say, no, don't worry about that guy blowing that big puffs of vapour or whatever it is in your mouth, it's not harmful. I think you've got a bit of a challenge on there. So happy to support the recommendations, but yes, with the proviso that it's still disappointing to see this is where we are in 2019 still, despite the massive investment to date.
Councillor Newman, and I'll just check with Member Brown. Can we come back to you after Councillor Newman? Yeah, cool. Okay. Councillor.
Yeah, thank you, Chair. Look, it's been an interesting discussion. I'm not quite sure what the answer is in relation to vaping because Dr. Jones, I think, is a pretty compelling advocate for me. But one thing I would say, Chair, and I raised the question with Stuart Jones, really is this is action for smoke-free communities, but we are silent on the issue of cannabis here. That does roast the lungs as well. I think it contributes to respiratory diseases, and more to the point, Dr. Jones said as much too. And we talk about that the evidence here is the effect of smoking on Māori and Pacific peoples who represent 40% of those who do smoke in Auckland. I bet you that that particular demographic will be overrepresented too in terms of those who smoke cannabis, unfortunately. It's not addressed in this report, and I suppose that what we're trying to do here is get...
I don't know if it's...
I think they'll be overrepresented. The number is a debatable. Yeah, I appreciate that. But the point being that we need to be able to address all activities that in relation to smoking. We won't be doing it here, fine, but we should because there will be debates coming up about it. And I would like to see people not smoking anything, frankly, whether it be cigarettes, vaping, cannabis, synthetics, whatever. We should take a position on those matters. Anyway, so I suppose that, yeah, we're going to pass these amendments, and I think that there will be, I will be interested to see the implementation. When do we expect to report back on the implementation?
I think after the election, so it won't be until probably April 2020.
All right, well, that will be good when we do get that, well, when whoever is here gets that report back, because I think that it will be interesting to see what progress has been made, and hopefully we will have an emerging consensus from within the community of agencies that are involved in this around the whole issue of vaping, because that will be a very interesting discussion indeed.
Member Brown.
Yeah, so I've got advice about the second element of work, that it does include the greater communities that I was worried about was excluded in the report. So thank you to the officials for that. But in the context of, and I'm right with Councillor Newman on the implementation plan side of things, because with all respect to the statistics and the demographic, fiscally, we're applying quite an unequitable value of money up against the most needy communities, because arguably 45 or 40% of the funding remains for those that are making the great progress to the quit line, and it's leaving those at the higher rationale and percentage of 4+%, with only an additional $200,000. Yet it's the single largest challenge within the whole effect that we're trying to achieve here. So just for the purposes of summarising and ending my conversation on it, I'm keen in the implementation side to see an improvement of the value allocations, an improvement towards a greater investment up against those two needy or multiple needy communities versus the great progress being made on the other side, which seems to be less than 1%. So I'm at a bit of an issue of how it is that the greater needed communities only really just got more than the general community that doesn't actually need the amount of resources if I was just to look at those community demographics and statistics that these other two communities need. So on the surface of it, it just looks like the numbers have been cut up against the pie. That the pie chart looks like the Māori PI population is 40% of the issue, leaving the rest of the population at 60, which will just swap the funds around and it looks really good. We give the needy population 40%, the unneedy or the ones that are not so needy, 60, and the ones not so needy 40. So I'm wondering, in the context of our CEO work in the implementation side with the officials, that they reflect on that, because I'm going to come at them again when the implementation plan drops on this matter. Kia ora.
Last two quick, okay. Last comment, Councillor Lee, and then we'll put the recommendation.
Very brief and not as profound as my colleagues, but I think it should read, is a legitimate tool rather than and. That's all, Madam Chair.
That in and of itself is profound, Councillor Lee. Great. That's good.
Have a vote.
On this, I'm going to put those recommendations, all those opposed say aye.
Aye.
Against? Carried. Well, thank you, everybody. Thank you.